Good afternoon. Mahalo for joining us for today's Health Human Services hearing, Thursday, April 16, 2026, 3:20 p.m. Conference room 225, meeting being streamed live on YouTube. In the unlikely event we have to abruptly end this hearing due to technical difficulties, we will reconvene and a public notice will be posted on the legislature's website. And as always, there's a 1-minute limit on testimony, although I don't think it's needed. First up, GM 544. Consideration confirmation, Health Planning Council, Windward Oahu Sub-Area, Miriam Chang. And it is for term to expire 06/30/2029. And first up on the agenda testifying is Shipta. 544, yeah.
Good afternoon, Vice Chair and Chair. Once again, we're really delighted to have a new candidate for Windward, our Windward Advisory Council, and Dr. Miriam Chang. She's got a degree a medical degree from John Burns School of Medicine, but she actually was on the mainland and did some work there for a while. But she's been here for 25 years working on the Windward side. She works with in Haula and at Ko'olaloa Health Centers, which she helped found. So she's been part of the Huio Haula, and just all sorts of really great community stuff. But in addition to that, she's a dedicated physician. So what a super member for our advisory council she will make. And we're just really excited to be attracting these kinds of talent. So,
Thank you, appreciate it.
oh,
Okay. It's all right. Individual Tihani Hunkin in support, and then Dr. Amy Nielsen, individual in support, and that's all the testimony we've received. Is the nominee present either here or on Zoom? Would you like to make a statement to the committee, or just stand on your resume too if you like?
there you go.
Up to you.
Thanks for having me here, for the privilege of
Yeah.
being on
I
the
saw you at the
committee.
last hearing. You're looking at you like, hey.
Sorry.
No worries. All good.
I don't have a lot to say other than I've been really concerned about the health of our people. So I'm semi-retired now, but I'd like to work on as many things as I can to help improve it. And I'm okay with working for the whole state, especially the rural areas. I grew up in Pupukea,
Yeah, there you go.
back when
Perfect.
nobody knew where it was.
Sounds good.
Yeah.
Well, your voice will be important when it comes to rural health transformation and the grants and such that are being rolled out. So thank you for stepping up. Sir. Members of the committee, questions on the nominee? Nope, see none. Thank you for being here. Okay. Next up, we have Center for Nursing Advisory Board, Terrelyn Luke, 06/30/2030, expiration date of the term. And first up, we have Hawaii State Center for Nursing. You there? Oh, go ahead.
Yeah, they're right there.
Yeah.
Sorry.
Aloha. Sorry I wasn't able to be there in person today. My name is Laura Reichart. I am the director of the Hawaii State Center for Nursing. It'd be a pleasure to have Terry Luke on our advisory board member. We've been having more conversations and meetings, and she is a past intern and fellow of our evidence-based practice program.
Okay, thank you very much for being here. We appreciate you testifying. We also have Hawaii American Nurses Association.
And part of our testimony. Thank you.
Okay, thank you so much for being here. We also have, Hawaii Nurses Association, OPEIU, Local 50. They have testified in support, and several individuals, Elise Nakamura, Heather Salvador, Francisco Lau, and Tani Lita in support of the nominee, and late from Keikoa McClellan as an individual. Keikoa, are you online?
Not present, Chair.
Okay, sounds good. And I believe we have the nominee online too, so if you'd like, you can go ahead and give us a statement.
Aloha, and thank you for having me on for the hearing. I am presently in Detroit, Michigan, where I'm at a professional issues conference for nursing, so I apologize for not being there in person. I am a very good advocate for the nursing profession, and by my statements on there, I have been a registered nurse since 1992, 34 years here in Hawaii only. I am currently the president of the Hawaii Nurses and Healthcare Professionals, AFT Local 808s, for the past 4 years. And my passion is really taking care of the workforce as well as making sure that our community is well served. So I am looking forward, as Laura mentioned, I have taken evidence-based practice from the Center for Nursing. I value all the research that they do provide for our nursing profession and also the opportunities that they provide. I've attended also some of the CEU things, so I am very excited to be on the advisory board and to help make sure that the mandates and the act that this center was brought up for is fulfilled. And also making sure that we do allow for more opportunities for recruitment and retention for the nurses that live here in Hawaii. That is truly what I want to make sure it gets developed. And so I'm dedicated to making sure that we continue this in Hawaii. Thank you so much.
Thank you so much for the statement. Appreciate it. Members, are there any questions on the nominee? Seeing none, and the testimony of support,
Yeah,
okay.
can I ask a question?
Oh, yeah, please, I'm sorry.
Hi, Terry. It's Jared Kalole.
Oh, hi.
Thank you for stepping forward to serve on this board. I did want to ask, over the last several years, the nurses have come in and asked for legislative change to address some issues that many of the members of the nursing community locally have felt were necessary because of pressures in the healthcare space on nurses over the last several years and then during COVID. And at times the Center for Nursing and the various unions have not always seen eye to eye. You're now going to serve on the board and sort of inside the room in this capacity. What are your thoughts about trying to bridge the gap in dialogue in some of those areas where there has been conflict in the past?
Yeah, I think I've had with Laura and some of our other labor members is that the voice for the front line has been missing for quite some time. And I am hoping to bring the frontline voice directly into the Hawaii Center for Nursing. And also, I'm pleasantly, pleased when I'm looking at their strategic plan for 2025 to 2029, that one of the opportunities they have listed is to actually improve workforce conditions to enhance retention. And also by addressing staffing shortages, workforce workload demands, and job satisfaction to create a more sustainable nursing workforce. So I am excited that that is on their list of things for the next 4 years. And so I look forward to actually helping to contribute to that.
Yeah, thank you for that. I think it's been very challenging. I think I can speak for some of the other members of this committee when I say it's been very challenging to have an entity like the Center for Nursing that is a resource for many of us who are not healthcare practitioners to try and achieve some of the goals that they work on and that you have just mentioned, and then to have members of the healthcare workforce in our community come to this body and ask for things where there's conflicting positions on bills it gets really confusing for those of us that want to help advance workforce and healthcare access in the community, and definitely do not like being in the position of having to tell nurses from our community no, when everybody really is, I think, trying to achieve the same thing. So, I'm encouraged by your appointment, and hopefully we can have these discussions outside of contested public hearings and just all get on the same page, because I truly believe that's what we all want.
And I agree, Senator. Definitely the collaboration, that is pretty much my strength is in collaboration. So I'm really looking forward to working together with the advisory board.
Thank you. Thank you, Chair.
Yeah, no worries. Okay, anybody else? Seeing none, thank you so much. Hold shortly, we'll take up everybody for the decision-making. Next up, final, GM 753. Let's see, submitted for consideration and confirmation to Language Access Advisory Council, gubernatorial nominee Valerie Rose, term to expire 06/30/2030. First up, testifying on behalf of the nominee is Hawaii Family Caregiver Coalition. Written in support, and Tiny Salazar, an individual in support. That's all we've received on behalf of the individual. Anybody else wishing to speak on behalf of the individual? Seeing none, I believe I see our nominee online, so please go ahead and give the committee a statement if you wish.
Yeah, hi everybody. I'm Valerie. I previously worked at the chronic disease branch with their bilingual health aid section, so I'm just happy to be nominated, supporting, and honored to have be selected or whatever.
Okay, thank you so
Thanks.
much. Appreciate you being here, and really appreciate you stepping up and be willing to serve. So, members, have any questions of the nominee? Seeing none, I believe we'll just go right into decision-making. Thank you for
I have the
being.
vote
No, do we
sheets.
have a full three?
What's that?
We've got Montgomery on there also. He needs to testify, and then we do decision-making also.
Okay,
Different calendar. Here.
okay, sorry. I'm going off of this one here. So we're gonna go ahead and recess then?
No, well, he's right in.
Oh, okay. Oh, I didn't realize he was, okay.
321, okay.
It's on a different agenda.
Oh, it's on a different agenda. Sorry, we're
Okay.
on the 320 agenda.
Okay, sorry,
You're
sorry.
freaking me out.
Sorry. Okay, so hang on, Mr.
Okay, just
Dr.
one
Montgomery.
second, and then you're gonna come testify, sir, okay, or be here. Okay, first up, GM 544, Miriam Chang, thank you for your service.
You want me to do it?
No, go ahead.
Advise and consent is the recommendation. I vote yes, and other
With
members?
4 members present, with favela excused, are there any reservations? Any no votes? Recommendation adopted.
Okay, thank you. GM 705, Terrell Luke, recommendation is to advise and consent. Questions, comments? If not, for the vote, yes.
With Senator Favela as excused, 4 members present, any reservations? Any no votes? Recommendation adopted.
Okay, 753, for Valerie Rose, thank you for your service. Advise and consent is the recommendation. Members, questions, comments? If not, 753, I vote yes.
Senator Favela as excused, all members, the rest of the members present, any reservations? Any no votes? Recommendation adopted.
Okay, this concludes the 320 agenda.
Thank you. I'm calling the 321 calendar. We have GM 567, James Montgomery, State Rehabilitation Council, for a term to expire June 30, 2027. Testimony was already provided, except that James Montgomery was not present. And I see that James Montgomery is now online. So please, James Montgomery, why don't you tell us, identify yourself and let us know why it is you want to serve in the State Rehabilitation Council.
Well, greetings and aloha. Thank you so much for your time today and allowing me to just kind of express my desire. Number one, my resume kind of sets what I do. I'm the Director of Business Department for the Joint Base. And one of the areas that I'm responsible for is talent management. Quickly, what is my passion on this? My sister was born with an ability where she could not hear and sign. We had to send her off away from us at 13 years old. She graduates, tried to get a job from college, could not because no one would give her a chance. And so since I've been in this position over, I would say the last 10 years or so, totally, my whole premise has been to be aligned with the state and DVR to ensure that those with disability have a chance to make a great asset to our communities and beyond. So that's why I'm here today, and I'm hoping that you would accept my opportunity to serve with you all. Thank you.
Thank you very much, James Montgomery. Anybody else wishing to testify on GM 567? Members, any questions of our nominee? Okay, we're going to do decision-making later, Mr. Montgomery, and thank you very much for being willing to step up and calling in, and we've heard from the last hearing, you're a very busy man, so thank you very much for being willing to serve, and thank you for letting us know of your personal story regarding this space. Moving on, GM 768, also Kevin Nakamura, Board of Certification of Operating Personnel and Wastewater Treatment Plants, term to expire June 30, 2028. Kevin Nakamura, are you present?
Yes, I am.
Okay, please proceed. Why don't you let us identify yourself and let us know why it is you want to serve in the Board of Certification of Operating Personnel and Wastewater Treatment Plants.
I'm excited to be
Really?
nominated for this private sector seat, to use my 30+ years of experience in wastewater in both on-hands training and technical training to ensure that our upcoming apprentice wastewater treatment operators and current wastewater treatment operators have the aptitude and are certified correctly to protect our precious resources and environment. So I look forward to your decision, and I'm sure I will make a great asset to this Board of Certification board.
Thank you very much, and thank you very much for being willing to step up. Members, any questions of GM 768? Okay, thank you. Our decision-making is going to be very later on, and we are also excited that you are willing to step up when you're using your 30-plus years of experience, because wastewater, as you know, in this specialist industry, is super necessary for the certification. Okay, next up.
Thank you for that.
Thank you.
Thank you for that.
Thank you very much. GM 552, Pina Lemusu, State Council on Developmental Disabilities, for a term to expire June 30, 2026. Pina Lemusu, are you present on Zoom? Oh, you're present?
I have to testify for DD.
Okay, wait a second. Is Pina Lemusu in?
Yes, sir.
Okay, Pina Lemusu, why don't you let us know why it is you want to serve for the State Council on Developmental Disabilities.
Good afternoon, and I want to thank you for rescheduling my hearing. It was supposed to be yesterday, but I was not feeling good. So thank you so much for allowing me to be rescheduled and be before you this afternoon. Yes, my name is Pina Lemusu, and I am a person with disability. I have I actually been working for the Division of Vocational Rehabilitation for almost 19 years, and very honored to be considered to serve in this capacity. Although I've been working with the DD population for a very long time, starting as a counselor, then also as a supervisor. Now I'm a branch manager, and it's definitely my passion. For a person that was born without a disability and then later on acquired a disability, so I can understand both sides of the spectrum. And I continue to work with the DD Council and all of their different groups, and also their people to serve persons with disability from their department. So I am very honored and again, very happy to be before you, to state how honored I am, but also looking forward to great and wonderful things that I can be an asset and a contributor to the council.
Okay, thank you very much, Pina Lemusu. Anybody have questions of Pina Lemusu? Okay, you have, okay, I guess we're gonna have testimony, but we had closed testimony already on this one. And we were only gonna hear from the nominees themselves because we had a hearing yesterday on this, okay? But if you folks want to testify, come on up. You have 1 minute. You have 1 minute.
Okay.
Okay.
Aloha Committee, Angela Young, in my volunteer position here on behalf of Daintree for the State DD Council. And we stand on our testimony in strong favor of GM 552 for Pina Lemusu. I would like to highlight one part of our testimony that Pina has been a fan of the council's work for nearly 20 years, not out of obligation, but out of a genuine commitment to improving outcomes for individuals with developmental disabilities and their families. Her collaborative approach, institutional knowledge, and dedication to cross-agency coordination are exactly what is needed to advance systems change in
Angela,
Hawaii.
you're just reading the testimony we've already heard.
Okay.
So
All right.
thank you very much.
Thank you for the
Okay.
opportunity.
Thank you. Why don't you come on up since you're already here? And Pina can hear what you're saying. Please identify yourself.
My name is Russ Pascual Kestner, the Assistant Administrator for Voc Rehab. On behalf
Terrific.
of our Director, Ryan Yamane, and our Division Administrator, Lea Diaz, we're in support of gubernatorial nominee Pina Lemusu.
Yes, thank you very much for Department of Human Services. Anybody else wishing to testify on Pina Lemusu, GM 552? Members, any questions? Okay, are we ready to proceed with
Yes.
DM?
Yes, go
So
ahead.
for GM 567, James Montgomery, State Rehabilitation Council, term expired June 30, 2027. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation is to advise and consent of 567, the only excuse of Senator Favela. All other members present, any WRs no. Seeing none, recommendation is adopted.
For GM 768, Kevin Nakamura, Board of Certification of Operating Personnel and Wastewater Treatment Plants for a term to expire June 30, 2028. Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
The recommendation 768 is to advise and consent, noting the excuse of Senator Favela. Any WRs no's of the members. Seeing none, recommendation is adopted.
For GM 552, Pina Limusu, for State Council on Developmental Disabilities for a term to expire June 30, 2026. And Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
For your recommendation 552 is to advise and consent, noting the excuse of Senator Favela. All the members present, any WRs no. Seeing none, recommendation is adopted. Congratulations.
Congratulations. We're all excited for you to all to serve and be on your chair. Thank you. So we have one person. Recalling GM 562. 662. Chair's recommendation is to advise and consent on Olivia Kim. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation 62 is to advise and consent, noting the presence of all members excepting Senator Favela. Any WRs or no. Seeing none, recommendation adopted.
Okay, now with that, we are adjourned. Thank you.